डिजाइन में उस माइक से बुलवाना, ये थोड़ा
अच्छा इसमें
जी उठा के इसमें
हाँ ठीक है।
ये वाला माइक में प्रॉब्लम होती है।
यहाँ पे तो इसलिए कम है।
ठीक है, इसको इधर कर दो। Good afternoon.
मैं उधर पास में चली जाऊँ and then I can change my slides myself. That would be better.
I will change for you.
नहीं, वहाँ पे माइक है?
हाँ
है ना? मैं आके करूँगी अपने आप. It's easier for me.
Okay. So, good afternoon, and this is the 28th lecture of series of lectures by eminent scientists, and we have with us today Professor Uma Kumar. She is professor in All India Institute of Medical Sciences, AIMS, and most of you might have seen her on Doordarshan. She is a very popular figure in two talk shows, particularly one Aaj Savere and Hello Doctor. So and she is also associated with some studies along with the India Meteorological Department and Department of Science and Technology. So particularly the air pollution and effect on autoimmune system. So we are very fortunate that today she is with us, and despite of, doctors, how busy are they, but despite of very busy schedule, she is with us to deliver this lecture. So before proceeding further, I would request so we welcome Professor Uma Kumar. So DGM is on his way, and he will join us shortly. And I would request Anup to please introduce today's speaker.
Thank you very much, sir. A very good afternoon to all of you. I'm Dr. Anup Misra from IMD New Delhi, and I'm very delighted to get an opportunity to introduce our speaker with the audience today. We are honored to have Professor Uma Kumar with us, who will be delivering a talk on meteorological manipulation of melodies. Professor Uma Kumar entered medical school in Motilal Nehru Medical College in Allahabad, now in Prayagraj, in 1985. And after doing MBBS and MD, she joined AIMS, Delhi in 1996 as a senior resident doctor. And she became faculty in 2001 in the Department of Medicine. Professor Uma pioneered the concept of day care in rheumatology in India in 2012. And she created the rheumatology department at AIMS, New Delhi in 2015. And she has published more than 200 research papers and book chapters in various national and international journals and books. And she has supervised more than 50 MD, DM, and PhD students. Professor Uma completed more than 70 research projects, currently working towards air pollution and autoimmunity, and also trying to generate good quality evidence on the role of Indian knowledge ecosystem in health. And she is recipient of National Award for Outstanding Efforts in Science and Technology Communication in Electronic Medium by Department of Science and Technology in 2019. And she is recognized as an eminent Indian woman scientist in the field of medical sciences for taking initiatives of scientific excellence and contribution to science policy, particularly gender equity in STI and science communication in a report prepared by UNESCO, named as A Braided River, the Universe of Indian Women in Science in 2022. And she is nominated as an eminent woman scientist by UNESCO in India 2022. And she is awarded Australian Rheumatology Association Asia Pacific League that against rheumatology international fellowship in 2008. And she has received Bharatiya Manav Adhikar Samman 2013 and Atal Swasthya Bhushan Samman in 2019. And she is fellow of prestigious academics like in National Academy of Medical Sciences, World Health Organization, Royal College of Physicians, and Indian Rheumatology Association, International Medical Science Association, and Indian Association of Clinical Medicine, etc. And I request all of you to join me in welcoming Professor Kumar.
So, madam, this lecture is, we are broadcasting through YouTube also, and online also several audience are available. So I would request all to please post your questions in chat box. So after this lecture, we'll be able to take up few questions here. Thank you. So I would request now Professor Kumar to kindly.
Thank you so much. I change, huh?
Just test it once.
Yeah.
Okay.
Yes. Yeah.
Your mics.
So good afternoon, everyone. Namaste. It's my pleasure to be here, and at the outset, I would like to thank the Director General of IMD and Dr. Soni. I won't say he's a dear friend, but he is much beyond that. I've learned a lot of atmospheric science from him. And I would like to thank Dr. Anu, who has been very instrumental in making this talk successful today. And thank you all for sparing your time also and joining this talk, and the people who are online connected with us. So this is not going to be a didactic lecture. I also want your interaction. Basically, if you look at the topic, that seems pretty engaging, because if I may ask, what do you understand by this topic, meteorological manipulation of maladies? One or two people can actually speak, and that will help me in formulating the way I'll go along with my talk. Yes, please.
The maladies means old disease type. It's a meteorological manipulation means the interchange of environment, season changing. There's a old disease which reoccur in our body. We can say that.
Yes, very nice, very good. So that was in my mind when I was thinking about the topic for this talk, because many a time when we are at home or we are meeting with someone in society, people say that today I'm not feeling well, I'm feeling very stiff, my joints are paining, or I'm feeling little drowsy, I'm feeling heavy head, but they were all okay. And their life was also the way it was before, but that particular day suddenly they are having these manifestations and not feeling like working on computer. And for people like all of us, it's very troublesome, because we have to deliver and we are not able to contribute because we are engaged in something which is very intriguing and unresolved mystery, I would say. So yes, so meteorology, you would be knowing more about it than me. What I understood, that this is the study of atmosphere focusing on lower part of the atmosphere, which is called troposphere, and there are very many strata of atmosphere. It's classified in two. So and then maladies, as has been very nicely described by her, that it's a disease or disorder of the body. So how does environment, or rather weather, plays with our life? So I'm not focusing completely on air pollution, because climate change influences the weather. I'm sure all of you would agree with it, right? Initially, people say that when we talk about air pollution, or when we talk about humidity, or when we talk about temperature, people say they are very different. Environment is like local environment or the weather is different from climate change. But when I was reading, I found that climate change is directly influencing our day-to-day weather. There's rise in temperature, which is influencing the wind speed, which is influencing the humidity. So they are very complex interactions, which you know much better than what I know. So if we talk about meteorological variables, which are actually defined clearly, they could be terrestrial, which could be barometric pressure, temperature, humidity, wind speed, precipitation or rain, and sunlight, right? People also call it sunspots. Then spatial also, there are various geomagnetic activities which are going on around us, and which is also influencing our day-to-day mood, day-to-day physical health. So what are the organs where these factors play a role or influence? So as you can see, musculoskeletal health, that means effect on bone, muscles, ligaments, joints. And then cardiovascular, all of you know, heart and blood vessels, autonomic nervous system, then brain, which is central nervous system, endocrine, you know, like various hormones, insulin and other hormones are they are secreted by endocrine system. Like pancreas is one organ included in endocrine. And somatic changes, like that's a feeling of dull, feverish, headache. I mean, sometimes you will find that term used, multiple psychosomatic complaints. So we write multiple psychosomatic complaints when we, they are very vague complaints. We are not finding them to be associated with a particular organ or a system. Then we say multiple, person is feeling very depressed, not feeling like working, feeling very sleepy or not having sleep properly and very anxious. So all those symptoms are included under multiple psychosomatic manifestations. And then the immune system also gets affected with the changes happening in weather and obviously in climate change and air pollution. So now let's understand few terminologies which are like meteoropathy and then something called meteorosensitivity. Then meteoropathy could be primary or it could be secondary. Sensitivity is where individual is normal, but when there is weather is about to change or changing, they'll have certain manifestations. But when the weather reverts to changes completely, then different weather condition comes in, then they feel better. So they are sensitive to a particular meteorological variable, right? And meteoropathy is, you see, individuals who develop new diseases, right? But in the sensitivity, they are not developing the diseases. Their manifestations are very transient, right? But in meteoropathy, individuals, they develop new disease or the disease which they had. For example, I deal with rheumatic patients. So the patient has arthritis that is getting flared up. So then that is included under the terminology of meteoropathy. So this is more organic and pathologic than meteorosensitivity. All of us can be very sensitive, like it's cold outside. So we might feel some kind of, you know, tingling sensation in our fingertips or our toes, right? That could be because outside it's cold and then vessels are getting constricted. So we are feeling it. The moment we make our hands warmer, they just disappear, right? Or we can have transient headache because it could be more humid and cold. So then that can result in headache. But that will get better once one comes under comfortable condition. So it's a Greek word, like meteoropathy is a Greek word where meteora means celestial phenomena and pathos is obviously the pain. So the celestial phenomena resulting in painful conditions in humans. So meteoropathy is, as I mentioned, it's considered a new disease in current times, and it affects our psychological and physiological health. And women are more affected right? And according to a study, 30% of the world population is experiencing some sort of meteoropathy. And what are the manifestation under that terminology? I'll come to that later. And why it happens? One might think that then that is because of the failure of self-regulatory mechanisms in our body. Like what happens during summers? We are not experiencing normal summer. We are sitting in AC in our offices, at our home. Even when we go out in cars, we are using ACs. So what is happening? Our body is not adapting to that changed weather condition. So because of that, we are developing, like we are sitting in this, I think, comfortable, warm, cozy room. I'm sure heater is on here, so I'm not feeling that cold. And then we go out suddenly. Then we feel, it's cold, right? So that possibly result in this adaptation failure. And also the current lifestyle patterns, yeah, food habits, right? There are certain kind of foods which are inflammatory. Certain kind of food, like inflammatory foods, are like we eat junk food like pizzas and pastas, and our body, there's something called gut microorganisms are there. If some scientists out here would understand that. So we are very differently tuned than the Western population. What we think, what is happening in the West is right for us also, right? So these days there is emphasis on Indian knowledge system or Indian traditional knowledge system. So there is a basis for it, because people take oatmeal in the morning. Oat is not meant to be for Indian population. Ethnically also we are different. And ethnicity also affects our cellular interactions, our immunity, our gut microbiota, right? So uh, that is also causing lots of problem these days in individuals. Then what are the symptoms? As I was telling you, like meteoropathic, when you will say that, and symptoms can vary in individuals in different weathers. And like myalgia, which is pain in muscles, right? As if you have worked so hard or exerted so hard and then doing some unaccustomed activity, then our muscles pain, right? So that kind of sensation. Then headache, as I told you. Here I would like to say that even migraine. How many of you have suffered from migraine ever in your life? Migraine, you understand, headache, it could be hemicrania also, like having headache on one side and then can feel nauseating. We may not like seeing the light also, we just feel like sleeping, and that goes off. So migraines are also precipitated with people. Sometimes it's cold and suddenly you are exposed to cold, or you go hill stations, there's snowing and you start having headache and your watering from the eyes starts, right? So then there is change in blood pressure can go up because of vasoconstriction. There could be sleep issues. One may not feel get the proper sleep in the night. There could be mood changes for no reason. Everything is fine in life, but not feeling happy. The gloomier days, right? During winters, we feel very gloomy. We don't feel excited or active as we are during, normal summer months. Then anxiety for no reasons, change in heart rate can go up. This is called tachycardia, which is palpitations. अचानक से धड़कन बहुत बढ़ जाती है, feel होता है कि भाई we become aware of our heartbeat. And then stomach disorders like dyspepsia, acidity, fullness in the stomach, and even having loose motions, that which is not infective, but that is all happening because of change in weather. And people who are sensitive to weather, and people have started believing that meteorosensitivity is a continuum to meteoropathy. Like initially they are sensitive, and if they keep doing that way, then they can become pathic also later. Breathing difficulty, like normally one walks like doesn't feel dyspneic or breathless, but during winters one feel breathless even walking short distances. Or joint pains, but that joint pain is not arthritis, but still one feels pain. When you wake up in the morning, our joints are stiff, right? Why is that happening? I'll come to that little later. I just could gather a few studies on meteorological factors affecting humans. And as we all know, we are approaching towards controlling communicable diseases, many communicable diseases like leprosy, tuberculosis, and all that, Kala-Azar. But now the prevalence of non-communicable diseases is increasing, right? But this study had looked onto the factor which influence communicable diseases. So I'll not go into the projection. Name few communicable diseases, infective diseases. Yeah, flu and cholera. Yes, very good. And then other communicable diseases, infections. Which we had just been not out of COVID. Still, we do keep getting COVID cases, but we are not worried about it. So all those things are there. What about vector-borne diseases like dengue, malaria, right? So weather factors, they influence these infections. And most important is precipitation and temperature, I have mentioned. So we know when it's more raining, then we get that year, we get more dengue and malaria also, right? And but heavy rains can protect us from dengue. How? Because what happens when there's water will not accumulate. It would just be, yeah, it will be washed off. So that heavy rains can actually be little protective. But it all depends whether that fresh water is collected at various sites. And then temperature, there is a very there's a range that is somewhere around, I think it's 16 to 22. And when the temperature goes beyond 30, then uh, these viruses, they don't multiply, right? But if the temperature is lesser, right, then what lesser means, it's not in that tune where this virus is multiplying within the carrier. Then what happens? Suppose there's rise by 1 degree, so it can alter the cycle, and infection can actually increase. Why? Because egg laying is increased, the cycle within the mosquito also gets shortened, and even the vector bites the human more than in that other temperature range. So that way these temperature and rain affects the occurrence of various even endemic diseases. This is just to show you, as you can see, the 4 meteorological factors were found significant, and they were like temperature, relative humidity, and the wind property. How would wind affect the infection? Yes, if there are heavy, we call it fast winds, right? So it can be transported. It may not really be at a one place. So then it can actually reduce the prevalence of these diseases, malaria, and the leptospirosis is again waterborne disease. So it is related to rains. The day when there are heavy rains, then we get more cases of leptospirosis, where patients, they develop multiple organ failure, like liver is affected, kidney is affected, patient has fever. Well, this paper actually looked at the impact of meteorological factors and air pollution on respiratory disease. So everybody knows that air pollution predisposes the individuals to respiratory diseases. There's no rocket science, because when you talk about air pollution, everybody talks about airway diseases, right? Not many know that air pollution can cause other problems also, like cardiovascular diseases. It can increase the risk of stroke, and even certain cognitive impairments air pollution can result in. There had been one study where ultrafine particles were found inside the brain, right? In one of the autopsy studies which were done. So you can imagine what this is called. And then it causes endothelial dysfunction when it goes to the blood, because we know that 10 PM10, our nasal hair can actually block them there, but the smaller particles, 2.5, they go into the airways, and ultrafine, they go to the bloodstream and then reaches to the various organs. So endothelial dysfunction results in diabetes, hypertension, and lots of other diseases. Hypercoagulable states, that means the coagulation property of the blood increases, right? I'm trying to make it simple. I don't know whether, because not medical people are here, so if it's going too simple, you can always tell me and I can change that. So no. Right. Yes,
Is it
sure.
normal that ultrafine particles are being present in our blood?
Studies have shown that ultrafine particles are there in the blood, because through blood only they can reach to the organ. And what is happening, all these macrophages, the cells, immune cells which are there in the body, scavenging cells, they try to remove them, but they damage those cells also, and that initiates inflammatory response.
Is there any blood test to check it?
No, no. We cannot call, it's not, nothing in that, it is research domain, not therapeutic domain still. And even if we check it, how are we going to help it? Like ultrafine particles like nanoplastic is there everywhere.
At least we can promote micro people that this is going and this is from your blood.
Right. Microfiber mask, I was reading somewhere, even the cups, those plastic, not plastic, the paper cups, even the tea bags, and even those masks, they have nanoparticles or nanoplastic particles. So I don't know, it's not so simple to restrict a particular constituents, because there are many things which are working in a very synchronous way and affecting our health.
Is that study in India or
No, India also, there are studies, but the good quality studies are not there from India. Many studies, but there are studies from India as well. Yeah. Yes.
Can we get such kind of long-term data from IMS, these diseases?
Yeah, sure. I'll come to that. I'll discuss some of our findings, and then we'll take up these questions. So surely we can work together and generate good quality data, which will have influence on the policy making. So now coming to the joints, because that is a common symptom which one comes across when there is change of weather. पहले हम सुनते थे ना, जो हमारे घर में बड़े बूढ़े होते थे, या वैसे अभी भी जो लोग होंगे, वो कहते थे कि वो कोई देर एयर होती है, कुछ पुरवैया एंड पछादिया होती है, ऐसा कुछ बोलते हैं, तो वो कहते थे कि कुछ ऐसे हो रही है कि घुटने जाम हो गए हैं. मतलब ग्रैंड पेरेंट्स यूज टू टॉक अबाउट इट. या फिर नहीं भी पता चल रहा है, तब हम यहाँ, और ज़्यादातर ये जो प्रॉब्लम्स होते हैं, सिम्टम्स होते हैं, वो एक्सट्रीम्स ऑफ एजेस में ज़्यादा अफेक्ट करते हैं और एल्डरली पॉपुलेशन को ज़्यादा करते हैं, क्योंकि वो सेम मैकेनिज्म के अडेप्टिव मैकेनिज्म्स उनमें थोड़े से फेल होने लगते हैं, राइट. तो कहते थे कि अब वो हवा आने वाली है, पूर्विया, या बारिश होने वाली है, या कहीं और बिजली कड़क रही होती थी, तो उनको वहाँ फील हो जाता था, मे बी सम इलेक्ट्रोमैग्नेटिक changes. When I was reading it, I found that Earth has neutrons on its layer, and those neutrons are changing to protons constantly, right? And that will have its own electromagnetic field, and we are there in that field. So somewhere that is influencing our health as well, right? So if you look at the joint structure, you'll find there is this yellow line is articular cartilage, जिसको shock absorber कहते हैं ना joints में. Bone, otherwise there are two bones, they'll hit each other, there would be more wear and tear, the damage would be more. So there is this cartilage lining which is called shock absorber, right? And then there is a joint cavity. Within this cavity there is a fluid, we call it synovial fluid, and that is very little fluid. Under abnormal conditions, or when there is inflammation in the joint, this fluid concentration or level, the quantity of fluid increases, and so we get swelling in the joint, right? And this fluid is secreted by a layer which is called synovial membrane, which covers the articular surface. Then there is a joint capsule, एक joint capsules होता है, और वहां पे जो fluid है, that is constantly exchanged with the fluid actually washed off, I would say, not say exchanged, because there are lymphatics which are coming from the joint, right? So that whatever fluid is there, that is getting replaced by new fluid, and the rest, because there would be, all cells are metabolizing, and there are cells even in the fluid, right? So those metabolic products are taken away with the fluid when that is getting replaced by the new fluid from the synovial. Synovium is secreting fluid constantly, but that is not getting accumulated, that is getting replaced time to time. Therefore, joint movement is very important, because when you move your joint, you are increasing the circulation in your joint. So if you are increasing the circulation, that would result in taking away those inflammatory markers in the fluid also in the circulation. So it's important. And I have written intra-articular pressure is somewhere between -2 to -12 millimeter of mercury. This varies according to the joint, like how big is the joint. But one has to remember this is subatmospheric. So when there is change in the atmospheric pressure, that is going to have some influence on our tissues, be it cavity or it is or at the cellular level, right? So yeah, it was just to show you that, I mean, as this forecast is given, so one can say today you have to carry your umbrella because it's my train. The viewers can say that, okay, you're going to have your creaky or painful joints because it's going to be cloudy. The atmospheric pressure during that cloudy weather, atmospheric pressure is low and humidity is high. Am I right? Yeah. So humidity is high. So what happens when the atmospheric pressure is low? Then what would happen? The structures, they'll expand. When it is more, then they would be, I won't say compressed, but they would be in their normal form, maybe, right? So that is actually influencing the cellular pressure as well as pressure within the cavities. Jahan cavities are in the joints or pleural cavity or yeah. Even pericardial, but there are no studies to support that. But in joint, there are studies to support that when the pressure outside is low, one might feel pain in the joint. So these are the two parameters which have been found to be associated with pain in the joint. In normal individuals, I am talking, or patients who have arthritis, their pain gets worsened. But there is very conflicting data. Now, there are some studies which say it can happen, it can increase the pain. There are some studies say that it does nothing. And the reason for that is there is no standard way or SOP to conduct such studies. Different studies are being done in a taking different parameters in consideration, measuring different parameters in a different way, and the sample size, it all differs in studies, so we cannot compare. But it seems true, then where there's low barometric pressure and low temperature, then the joint feels more painful. But it is very frustrating for the doctor. Patient has rheumatoid arthritis, right? A doctor or a physician is not aware of this. What doctor is examining, looking at the blood sample, says it's normal, ESR is normal, CRP is normal. When examining the joint, says your joints are normal, they are not swollen, right? And patient says कि pain हो रहा है, pain हो रहा है, pain हो रहा है. तो वो कहेगा कुछ नहीं पेन हो रहा है, सब कुछ बिल्कुल ठीक है, तुम ये करो वो ठीक हो जाएगा. But if you are able to explain to the patient or to the, और फिर relatives क्या बोलते हैं for a lady, वो सोचेंगे कि शायद काम नहीं करना चाहती है, that is why. No, this is what we face in our daily practice. They think, कई बार बोलते हैं कि काम नहीं करना चाहती, शायद इसलिए बहाना बना रही है, डॉक्टर ने कह दिया सब कुछ नॉर्मल है. But how traumatizing it is for the patient. Patient को पेन हो रहा है, experiencing the pain. So it's very important for us also, for doctors to know the effect of weather and environmental conditions on different organ systems. Well, this is just to show you how it is playing the role, the weather parameters. Meteorological factors, I said, they are all meteorological factors I'm talking about. So what is happening? They can influence any cell in the body, right? There are receptors on our skin surface. We all know They are receptors for pain, they are receptors for temperature. So when I say mechanoreceptors, they are experiencing, they are sensing the pressure. Okay. So skin and ear. Ear, we have vestibular system where when you go high up, when you are flying or getting mind, sometimes you can have giddiness, right? So it is all because of that, right? And then there are wet receptors also on the skin, which can sense, which can sometimes patients who have migraine, they can feel cold. Them, particularly in migraine people, it is seen that wetness can be felt on the forehead. So these receptors, what they are doing, they are carrying information from those receptors is carried to the central processing system. I have written CNS. There is hypothalamus. So hypothalamus has various zones for perception of various sensations, right? So what that does, the symptom, this is called hypothalamo pituitary adrenal axis. So when the sensation comes there, it feels some kind of, for example, I'm just giving one example. There is increased pressure on your skin that is going centrally. And centrally, what is happening? This is perceived as certain kind of stress. So what happens under stress? Steroid hormones are secreted, right? So when the hypothalamus synchronous comes to pituitary, ACTH is secreted, comes to adrenal, glucocorticoids are secreted, and those hormones actually, there are catecholamines, there's sympathetic nervous system, parasympathetic nervous system, you must have heard about. So, right. So sympathetic nervous system, when gets stimulated, what it results in? It results in tachycardia, palpitations, increased blood pressure, right? Diarrhea. All those things can happen. So that gets stimulated. Then that is autonomic nervous system. Then immune system also gets influenced with this information, I'll say. And I've written melatonin and cortisol that I told you. Melatonin is a hormone which is responsible even for immune regulation and also for sleep, right? It influences. And so what happens at the central nerve, their mood changes happen, and if person is unhappy or depressed, will feel the pain more than the person who is happy, right? Right or wrong? If we are very negative and we are very disturbed and unhappy, then slightest of pain will be perceived as more. जब बहुत खुश है, सब चीज चल रहा है, तो चोट भी लग गई, पता नहीं चला. So it happens. This is the body mechanism. So tips to lessen weather-related pain is be active. As I said, it improves the circulation, right? Because what happens when there is inflammation, there are cytokines. Cytokines are chemicals, inflammatory markers, right? They sensitize the nerve endings. So the perception of pain would increase. Pain threshold will go down, right? एक टच जो पेन नहीं कर रहा था वो भी पेन फील होगा, right? So that is how it works. So be active. Motion is lotion, right? Exercise and yoga. We all know exercise improves circulation. Exercise elevates your mood. Why? Because endorphins जो कम हो जाते हैं कुछ वेदर इन्फ्लुएंस के अंदर, जो कि नेगेटिविटी फील कराते हैं, वो you can improve upon them. So if endorphins are happy hormones, happy hormone release होते हैं. Then yoga, we all know, has it's a very intricate process which soothes our I would say our mind and also reduces the inflammation. We have done study on the yoga effect in patients with rheumatoid arthritis, and we found it's a randomized trial, well published in a very good journal and accepted world over, that patients who did yoga and took medicine fared better than people who just took medicine. Improvement क्या था? क्योंकि inflammation went down pretty early. They are very happy. Depression levels, depression was less in those individuals. They were able to perform better. This was a 3 months clinical trial. So in 3 months, they had so much of benefit. So you can imagine what can happen if person is doing it lifelong. Then keep warm. right? If weather related pain, right, take hot shower. Okay, that can reduce the pain. Or apply heat packs. I just said if the pain is happening in thigh muscle or calf muscle or any localized area, then heat packs can be applied. Nutritious diet means there are certain foods which have lots of antioxidants. Remember the process of inflammation. Those who have worked in that area, there is oxidative stress, which results in inflammation, right? So oxidative stress is when there is imbalance between oxidants and antioxidants, which are naturally present in our body. So if you take food which is rich in antioxidants, right, then that will try to balance out the oxidant, increase amounts of oxidants in our body. So nutritious diet is very, very important. Then painkillers and gel temporarily can be applied. Well, now coming to autoimmune diseases, something which is very close to my heart. We know these days there is increased prevalence of autoimmune diseases. As I was telling you that we are almost controlling communicable diseases, but the prevalence of non-communicable diseases is increasing. So as you can see in that graph, there is increased incidence and prevalence both for autoimmune diseases, right? And here if you see amongst autoimmune disease can manifest in neurology, gastroenterology, endocrinology, rheumatology. So rheumatic diseases have the higher prevalence and incidence of occurrence amongst all autoimmune diseases reported so far, and the burden is more in developing countries. Here you can say that rheumatoid arthritis old incidence is less than the newer incidence of rheumatoid. The upper bar, lighter bar shows new incidence and the darker bar is old incidence. So you can see that prevalence and incidence of rheumatoid arthritis has increased. Well, air pollution obviously affects the immune system, and it's a very intricate process of modification of immune system, and there are various cells. Just to tell you, there's not one cell which is called immune cell. There are multiple cells, multiple proteins in the body like complements, B cells, T cells, multiple types of B cells, multiple types of T cells. So they get affected in individuals who are exposed to air pollution the way we are getting exposed. So these days concept is that genetics control your autoimmune disease occurrence only by 30 to 40%, right? So suppose in this room, even if 80% of us have some genes responsible for autoimmune disease present in us, but we may not develop autoimmune disease at all, or 10% can develop or 20% can develop. That depends on the environmental factors, right? So environmental factor is contributing by 60 to 70% in the occurrence of autoimmune diseases, and various triggers, environmental triggers, air pollution, smoking, infections, right? These are the three important triggers of autoimmune diseases. Rheumatoid arthritis, as all of you know, is chronic inflammatory autoimmune disease, and if not treated can result in disability, deformity, and it reduces the lifespan by 10 years in individuals. But we have very good drugs available to control this disease, and individuals can lead normal life. So now coming to our study, when we started this study, we did not have much data, and the whole thought process came in that patients were doing good on drugs, but suddenly during November, December, we start getting cases on January, February who come with exacerbation of symptoms or increased symptoms to us. Why is this happening? Nothing has changed. They are staying in the same locality, they are eating the same food, they are taking the same drugs. Nothing has changed. But why is this? So then we thought of doing, and then a lot of people were talking about air pollution those days. We started this study, I think, a decade ago. So just to identify air pollution as a modifiable risk factor for intermittent exacerbations of rheumatoid arthritis, in our clinic, we have data of our patients of last 40 years, where we can actually go back and trace when a particular patient had active disease. And then we also tried to look at subclinical autoimmunity in normal healthy individuals who were staying in Delhi for last 10 years. And they had not relocated in between anywhere, but they were all non-smokers. And we chose the time points January, February, May, June, July, August, and November, December for our study. And there were two components to this study. A retrospective component where we digged out the data from the files, and then the prospective component in the same patients, what is happening, so that our study gets robust, because recall is not always taken as a very good quality data, right? So, and we have objective measures to study disease activity in our patients, as I've written DAS 28, which is disease activity score 28. And this air quality data we retrieved from DPCV. And in this data acquisition, air quality data acquisition, Dr. Soni helped a lot. And this was the first time we were venturing into this domain. So it was a true learning. So we recruited our patients, and I'll just show you. This is retrospective part of our study. So what this is the patient numbers mentioned. So red, you can see you are getting the highest number of patients who had active disease. We have averaged the data into 1 year, right? Of 4 time points as I was showing. So we just averaged it, and this is what we could get. So Jan Fab 300, you can see consistently in January, February, there are more number of patients who were reporting to us with active disease, and even in November, December. And we all know that air quality is very bad during these months. This just to show you this diagram where the peaks you can see November, December, sorry. Yeah, and even in Jan Fab, you have some increase in patient numbers. This was the correlation coefficient when we calculated. We could find correlation with PM10 and PM2.5 with disease activity in our set of patients. This is prospective part of the study. I have taken very few select data points because of the limitation of time. It would have taken very long if I had deliberated in details. So here, this was a prospective components. That means the same patients we have chosen in the retrospective component, we called them at these time points. And then we looked at whether they have disease active or inactive. And that activity assessment was objective assessment. Again, you can see more number of patients had disease active in Jan, Feb, November, December, right? Even in this graph, you can see that during November, December and Jan, Feb, more number of patients had active disease. And here again, we could find correlation with PM10 and PM2.5. So what we concluded that PM10 and 2.5 levels were actually making our patient flare despite being on drugs. There was another part of our study where we looked at the prevalence of autoantibodies, which are supposed to be the surrogate marker of autoimmunity, and to study the prevalence of inflammatory markers. Again, we chose 18 to 40 years of individuals staying in Delhi for more than 10 years. They were all non-smoker, non-alcoholic, and we found, and these were the markers we studied. And also we looked at the distance of their home from main road using Google mapping. And then we actually categorized them into two groups, those who were staying within 200 meters of the main road and those who were staying beyond 300 meters from the main road. Here you can see that we found prevalence of subclinical autoimmunity in form of ANA, rheumatoid factor, TNF alpha is tumor necrosis factor alpha, and HSCRP is C-reactive protein, which suggests inflammation in the body. So that was different in two groups. That means people who were staying within 200 meters of the main road had more occurrence of these inflammatory markers and autoantibodies than the individuals who were staying beyond 300 meters, and this difference was statistically significant. The p-value is less than 0.05. So what does this suggest? When we go to buy a house, we try all the amenities in our near household, but that's not good. If you look at it, you are predisposing yourself for many infections. Why is this happening? Possibly vehicular pollution is more near the road, right? So possibly that is a reason. This is just to show you you can see the clear difference between the people who were less than 200 meters away or who were more than 300 meters away. So we concluded that autoimmune markers were present in 18% of the normal subjects, and inflammatory markers were present in 46.4% of normal subjects. That means that they did not have any disease, they were not having any addiction, their food habits were normal, but still they had inflammation in the body. What would happen? Chances are some of them might develop the disease over the period of years. If they keep on staying in the same location and their dietary habits get worsened or they develop some kind of addictions. This is just to show you how the disease starts. The first phase is genetic risk factors, as I had given the example that all of us can have the risk factor. And then phase B is there is this second hit when the environmental trigger comes in, and that trigger could be smoking. And smoking is not that you are smoking, your relatives also smoking within sitting near you or in your house, because once a person smokes, that smoke remains in the atmosphere at least for maximum of 9 hours is what is reported, and maximum concentration is in next half an hour to 1 hour. So you shouldn't think that one goes out and smokes and then comes in. So whoever passes by and stays there in that area where this person has smoked, it can still cause damage. And then here benign autoimmunity, that means when we inhale that is going to in our airways, there are certain proteins in our airways that are getting modified. We call citrination of C peptide. There's inflammation which is setting in. There are autoantibodies like they are being formed, but still person does not have the disease. You can find the markers. There are studies where bowel fluid analysis, understand bowel is like bronchoscopy. Have you heard about that? Putting scope in the bronchus in your airways and then taking the fluid out for analysis, and autoantibodies are seen even in that. For certain infection, that investigation is done to look for even infective organism. But person has no disease. Then later what happens, you see 18 to 35% they develop rheumatoid arthritis at 1 year follow-up who had autoantibodies present in their blood, and then they can have 1 or 2 joints inflamed and swollen, and subsequently the full blown rheumatoid arthritis can come in. There is one US nurse study which says the nurses were followed up for 30 years, and they actually looked at the nurses who were staying within 50 meters of the road, and they found that 7% of them, they developed rheumatoid arthritis. So it's a very slow process. Like if a child, maybe when we were young, we lived in a very good environmental conditions. We had good food, so we are surviving and we are able to perform and deliver. Our children, the way they are staying, we don't know what is going to happen with them 20 or 30 years later. And if we know, we can intervene at various stages, right? So this is just to show you how air pollution can cause problem. As I was talking about oxidative stress, there's reactive oxygen species, which triggers the inflammatory pathways and then resulting in increase in the population of self-reactive T cells and autoantibody formation, inflammatory response, and even the vitamin D. When we have, because of, you'll be knowing that better, when we have air pollution, then the UVB rays are not reaching to us in the same amount and quantity as they should. So we are not getting vitamin D synthesized. So vitamin D is immunoregulator, right? So we do develop lots of autoimmune diseases because of vitamin D deficiency, also as one of the trigger for autoimmune disease, and also it can result in flare in existing medical illnesses. So to conclude here, we cannot say weather does not matter. We can just wear woolens and go out and enjoy. Weather does matter, and we'll have to take care of our climate so that we do not have bad or worse weather conditions. And we need to understand our weather or weather various meteorological parameters to explain to the patient or to understand the person who is visiting us. Us means doctors. So doctors and the general public both need to understand the effect of meteorological parameters on our health. Thank you.
Thank you very much, Madam, for this very simple but very informative and exhaustive lecture. So we are now open for a few questions.
I made it very simple because I
Yeah.
felt that there won't be many hardcore scientists and medical people, so that if people understand, we can have lots of research questions in this domain.
So, just one, what are these auto antibodies?
Yes, what happens in our body? There's something called immune tolerance. When the immune system is developing in utero, when the baby is not born, and even after that, then that immune system is recognizing our own cells. It is not hitting us, right? So what happens when there is, for example, we had COVID, that virus particle or viral protein was mimicking our cellular protein, one of the cellular protein. So immune system, in the process of throwing that foreign invader out, was damaging our own cells. That we call it loss of immune tolerance. That's the first stage in development of autoimmunity. We call it autoantibodies because those antibodies are formed against our own cellular proteins. So they will damage our own cells, tissues, and organs. And that would result, like you have heard about rheumatoid arthritis, we have rheumatoid factor, we have anti-CCP, in lupus, then anti-nuclear antibodies. So normally also one can get those autoantibodies, but when the critical level is bypassed, and then the disease can result. So autoantibodies are antibodies against our own cellular proteins, our own cellular structures. So we call it autoantibody. Otherwise, antibodies are against foreign invaders like bacteria, viruses, because we do serology test. You must have heard about, we do for typhoid serology, right? We do for serologies, we do for other viral infections also, to look for how much is the antibody titer against that particular infection. Right. So that is all normal. But when they attack our own cells, our proteins, then it becomes autoantibodies.
Excuse me, ma'am.
Yes.
Can ये arthritis, rheumatology, ये जो है disease can be curable or not?
It is treatable. Curable is like you take the treatment and it disappears. It never disappears. It's just like diabetes and hypertension. कि दवाई खाएंगे ठीक चलता रहेगा और बिल्कुल ठीक चलता रहेगा, मतलब कहते हैं कि लाइफ में कोई प्रॉब्लम ना हो, वो वाली चीज है. बट इफ यू डोंट टेक ट्रीटमेंट थिंकिंग कि चल रहा है काम एंड सब कुछ बिल्कुल ठीक है, ऐसा चल रहा है, व्हाट हैपेंस, आई वाज टॉकिंग अबाउट लो ग्रेड इन्फ्लेमेशन इन द बॉडी, जो सूजन की स्टेट कह देते हैं बॉडी में, लो ग्रेड इन्फ्लेमेशन. दैट लो ग्रेड इन्फ्लेमेशन इज वेरी डैमेजिंग. दैट कैन रिजल्ट इन हार्ट अटैक, that can result in paralysis, hypertension, diabetes, and whole lot of other conditions. Low grade inflammation means कि जो आपके arteries and veins and all those, they can always be inflamed. Call it endothelial dysfunction.
Symptoms, what we can say symptoms ये going to मतलब हो सकती है बीमारी, symptoms कुछ आते हैं.
इसकी कौन सी बीमारी?
Like this arthritis.
आर्थराइटिस के सिम्टम्स अगर लेमैन में बोले तो आर्थराइटिस एक अम्ब्रेला टर्म है जिसके अंडर देयर आर 200 कंडीशंस इंक्लूडेड, राइट. लेकिन अगर हम रूमेटॉइड आर्थराइटिस की बात करें जो कि ऑटो इम्यून डिजीज है, तो उसमें जॉइंट्स में स्वेलिंग, रेडनेस, अर्ली मॉर्निंग स्टिफनेस ऑफ मोर देन 30 मिनट्स ड्यूरेशन, फटीग फीलिंग. सो ये सब जैसे सुबह उठते हैं तो बहुत ज़्यादा स्टिफनेस होके नॉट एबल टू वर्क, पेन, दैट इज द सिम्टम. बट जो और भी कंडीशंस हैं लाइक एसिली है, स्क्लेरोडर्मा है, बहुत सारे ऑटो इम्यून डिजीजेस हैं, उनमें और सिम्टम्स भी होते हैं. जैसे उंगलियां का कलर चेंज हो जाता है, वी कॉल इट रेनॉल्ड्स फिनोमेना. फिंगर्स जो भी एक्सपोज्ड एरियाज हैं, जब कोल्ड के एक्सपोजर पे दे टर्न वाइट, ब्लू एंड रेड, राइट, वी कॉल इट रेनॉल्ड्स. स्किन टाइटनिंग हो सकती है, ड्राइनेस ऑफ आईज हो सकती है, ड्राइनेस ऑफ माउथ हो सकता है, एक्सेसिव हेयर फॉल, स्किन में रैशेज, राइट, इनफर्टिलिटी, या फिर अदर वे राउंड इंक्रीज्ड अबॉर्शंस, डीवीटी, डीप वेन थ्रोम्बोसिस. कई बार ये होता है पेशेंट ट्रीटमेंट ले रहा होता है क्योंकि क्लॉट कर गया था ब्लड उसको कहीं भी, तो फिर somebody sends the patients to us, जिनका एंटीफॉस्फोलिपिड सिंड्रोम जो हाइपरकोगुलेबल स्टेट है. तो मल्टीपल मैनिफेस्टेशंस हो सकते हैं इन ऑटो इम्यून डिजीजेस के या आर्थराइटिस के भी.
मेडिसिन है इसके लिए क्या?
जी, बहुत सारे मेडिसिन अवेलेबल हैं आज के टाइम में. तो अगर देख
डॉक्टर तो सिंपल
नहीं, ऐसा कुछ नहीं है कि पेट में लगाने का इंजेक्शन या कैसा इंजेक्शन, लेकिन जो शुरुआत होती है इसकी कुछ ड्रग्स होती है जिसमें वी कॉल इट डिजीज मॉडिफाइंग एंटी रूमेटिक ड्रग्स. दे आर ओरल ड्रग्स, नहीं काम करते देन वी गो टू बायोलॉजिक्स और स्मॉल मॉलिक्यूल्स जैसे जैक इनहिबिटर्स होते हैं, जेनस काइनेज इनहिबिटर्स, वो अवेलेबल हैं. तो वो एक के बाद एक, ऐसा नहीं है. जैसा मैंने कहा कि या तो कोई दवा ऐसी हो कि वो कहते हैं ना रामबाण, कि आपने दिया तो ठीक है आप उस पर करोड़ों खर्च कर दो, लेकिन जब ऐसा है ही नहीं, हो सकता है आने वाले टाइम उस दवा का भी असर खत्म हो जाए, देन व्हाट नेक्स्ट. सो इट हैज टू बी वेरी स्लो ग्रेजुअल प्रोसेस जिसमें टाइट्रेट करके डोजेस चलते हैं.
आपने बोल रहे थे कि ओट्स जैसे कि हमारे हैबिट के नहीं है, तो oats
हमारे
को
यहाँ नहीं होता
तो
ना.
हमें इसको ऐड करना चाहिए या नहीं?
नहीं, ऐड करने में बुराई नहीं है,
हाँ.
ऐड करने में बुराई नहीं है. मैं क्या कहती हूँ कि हमारे इंडिया में इतने सारे डाइवर्स फूड प्रोडक्ट्स अवेलेबल है, लोकली ग्रोन फूड प्रोडक्ट्स अवेलेबल है जिनके बेनिफिट्स बहुत ज़्यादा हैं, है ना. तो हम जो मार्केटिंग गिमिक है और एक जो सेल कर रहे हैं चीज़ों को, उसमें उससे भ्रमित क्यों हो. मतलब वी आर इंटेलिजेंट इनफ टू आइडेंटिफाई व्हाट इज गुड फॉर अस, व्हाट इज नॉट गुड फॉर अस. तो हम सिर्फ वो सोशल मीडिया या फिर वो जो मार्केटिंग प्रोडक्ट्स देख के नहीं करना चाहिए.
उसको उसी को ही फॉलो करना चाहिए.
एग्जैक्टली, वो अपना फूड हैबिट करें, हेल्दी रहेंगे. एंड द क्लासिक एग्जांपल आई टेक ऑफ माइन, मतलब इन आवर टाइम्स इन 70s ये सब कुछ भी नहीं था. सो नाउ आई फील कि आफ्टर सो मेनी इयर्स ठीक ठाक है, मैं एबल टू डिलीवर, यूज्ड टू ईट एवरीथिंग घर में. वी पिज्जा एंड बर्गर आई एट फर्स्ट टाइम इन 90s व्हेन आई केम टू दिल्ली. तो आई मीन दैट इज क्लासिकल एग्जांपल, मतलब आई कैन से दैट विद कॉन्फिडेंस, अगर कोई इस चीज को डिनाई नहीं कर सकता. पेन किलर अगर आपको बहुत रेगुलरली प्रॉब्लम हो रही है तो आपको डॉक्टर को कंसल्ट करना है. एक आध बार कभी ले लिया पेन किलर, अगर मान लीजिए कोई महीने में 10 पेन किलर की जरूरत पड़ रही है तो आई डोंट थिंक इट्स नॉर्मल. तो डॉक्टर ये देखेगा कि प्रॉब्लम क्या है, फिर प्रॉब्लम आइडेंटिफाई करके फिर ट्रीट कर रहे हैं, दैट इज राइट, बट पेन के साथ गए और पेन किलर दे दिया, दैट्स नॉट द सोल्यूशन। नहीं हाँ नहीं, अगर ऑस्टियोआर्थराइटिस है जो बोलते हैं डीजेनरेटिव जॉइंट डिजीज होता है, नी में हो जाता है, तो आप योगा करें, एक्सरसाइज करें, लाइफस्टाइल मॉडिफिकेशन करें, वेट रिड्यूस करें, कुछ एक्टिविटीज है, नीज में प्रॉब्लम है तो आलती पालती नहीं, वी कॉल इट नॉट टू सिट क्रॉस लेग, क्लाइंबिंग स्टेयर्स एंड स्क्वाट, वो सब चीजें अवॉइड करनी है, तो इट रियली हेल्प्स। और योगा भी करना है तो डोंट सिट क्रॉस लेग, आप वो वाला पोस्चर लो। किस आई सेड जॉइंट का प्रेशर बात की थी ना मैंने, नेगेटिव प्रेशर जॉइंट में होता है, वो न्यूट्रल पोजीशन का प्रेशर था। अगर आप जॉइंट फोल्ड करके बैठ रहे हैं, नॉर्मल पोजीशन में नहीं है, तो प्रेशर इज गोइंग टू बी हाई। सो इफ द प्रेशर इज हाई इनसाइड एनीथिंग, वो बिना कॉन्सिक्वेंस होगा। साइंटिफिकली यूज्ड, maybe in a balloon, if the pressure goes very high, what would happen? So सब चीज का एक साइंटिफिक बेसिस है, and we do not have much data in this domain that is to be generated, and that would require very sophisticated equipments and well planned study, क्योंकि जॉइंट का प्रेशर मेजर करना, सरफेस का प्रेशर मेजर करना, and looking at the environmental pressure, so that has to be very properly conducted.
What are the natural ways we can maintain our bone density or other things as an expert? You can.
When the child is young, good calcium, vitamin D from the food products. I'm not taking supplements. मैं बात नहीं कर रही हूँ. Good dietary habits, good sleep pattern, right? No cold drinks. और कोल्ड नो का मतलब है कि एक आध तो लेते हैं, बट अभी क्या होता है कि खाना भी कोल्ड ड्रिंक से ही खाते हैं, right? No cold drink. So all those things have to be avoided, and have to understand by 30 years you are building your bone bank. उसके बाद नहीं बिल्ड करने वाले, उसके बाद your bone starts pouring calcium out, वो पोरस होने लगते हैं, whatever you may do. So to keep your bone healthy, the physical activity is very, very important. Anywhere in the body that ion exchange or nutrient exchange is happening between your blood circulation and your cells. So agar nutrients, the circulation is not adequate or not good, how would that exchange happen? So physical activity also improves your bone health, right? And so physical activity means not really going to the gym, even if you're running or you are physically active, doing your stuff, walking. People talk about 10,000 steps. So 10,000 steps chale, 8,000 chale, jitna physical activity badhani, that is important. Drink lots of water, have calcium rich food in your diet, have vitamin D rich food in your diet. And then vitamin D हम धूप में रह नहीं सकते, जिस तरह की धूप हमें मिलती है, it's not possible also. If you are deficient, take vitamin D. Don't keep taking vitamin D and calcium at your own. We have seen patients developing calcium toxicity and vitamin D toxicity, मतलब high calcium हो गया. And you must remember there was a study, BMJ is supposed to be very elite journal, blue journal category में आता है, and उसमें there was one paper a couple of years ago which said even the high level calcium can result, it can increase the risk of coronary artery disease. So you can imagine that is also damaging. So अपने आप कुछ नहीं करना है. If you are deficient, you are having any problem, take it. Otherwise, that's how it can be improved.
One more thing, ma'am. Is there any study which assess the impact of PM 2.5 on these like bone density?
Yes, there are studies available which have actually tried to link PM 2.5 or air pollution with bone health. There are many studies available.
Can we get such kind of data from the?
Yes. And taking data from, I don't think AIMS has conducted any study, but surely in times to come, we can think of generating such data.
Ma'am, actually, we have one more talk today. So Dr. Prakash is waiting for us. So
Yeah.
we can have your questions later. Sir?
Yeah. So let us thank Professor Kumar for this nice thing. And it's now time to express our gratitude to Professor Kumar, and we present a memento on behalf of India Meteorological Department.
very steady Dr. Soni ke support ke bina nahi, because initially to, I mean, these things are also very, very intricate and difficult. Thank you. Picture, please.
Picture.
Yeah.
Thank you.
This. Keep inside. जी चिन्मय मैडम को नीचे
मंगल
चलो पिक्चर को जाएगा एक कॉमन है ना ग्रुप फोटो you know these are important, we make memories, maybe after 20 years when we look at the album and then we'll find acha please come. आप भी आ जाइए, somebody else can. This I learned after COVID actually.
Yeah.
पहले मैं
Actually,
pictures नहीं है थी, travel के सबके साथ, but
इसलिए बहुत सारी नई टर्मिनोलॉजी हमने भी सीखी है.
thank you, thank you.
उसके बाद ही मैडम मैडम को नीचे मैं दूसरा एक लेक्चर.
Thank you, that.
Thank you, madam.
Some so we now start our second talk, and basically it's the 29th talk of this series of talks by eminent scientists, and we have with us Dr. Prakash Chauhan, Director, National Remote Sensing Center, and it's really an honor and great pleasure for us to welcome Dr. Prakash Chauhan. I'm extremely sorry and apologize, sir, for keeping you wait for 20 minutes because another lecture was going on. I would request Anup to kindly introduce today's speaker, Dr. Prakash Chauhan.
Thank you very much, sir, and a very good afternoon to all of you. We are honored to have Dr. Prakash Chauhan with us. And Dr. Prakash Chauhan obtained his PhD degree from Gujarat University. And prior to joining NRSC, he was the director of IIRS, Dehradun, since April 2018. Dr. Prakash joined Indian Space Research Organization ISRO in 1991 at Space Application Center SAC as scientist, and since then is working for applications of space technology, including remote sensing technology for geosciences, atmospheric and oceanic process studies, natural resource management for ocean and land resources. Dr. Prakash initiated research activities for planetary remote sensing to study solar system objects, mainly Earth's Moon and Mars through Indian planetary missions. His major achievements are in the area of Earth observation applications, including development of algorithms for ocean color parameter monitoring, retrieval and aerosol remote sensing for space-based air quality monitoring, climate response to various ecosystems, and disaster risk reduction. Dr. Prakash has done lead work in using the hyperspectral satellite data for Indian planetary missions such as Chandrayaan-2 and Chandrayaan-1 for lunar surface composition mapping. He had been the principal investigator for infrared imaging spectrometer IIRS instrument on board Chandrayaan-2 mission. And his work on Chandrayaan-2 IIRS spectrometer data has resulted in unambiguous detection of H2O and OH on the surface of Moon. He is currently serving as chair of working group of whole at STSC of UN, Committee on Peaceful Uses of Space. He has also served as chair for CEOS working group on capacity building and data democracy for the year 2018-19. He had also been member of prestigious NASA ISRO Planetary Science Group Working Group. Dr. Prakash has been awarded with Asia Pacific Region Excellence in Space Award 2023 by Asia Pacific Regional Space Agencies Forum and Professor P.R. Soroti Memorial Award for the year 2004 by Indian Society of Remote Sensing, and Dr. Vikram Sarabhai Research Award by PRL, Ahmedabad in 2009, and ISRO Merit Award by ISRO in 2010, and Satish Dhawan Award by ISRS, Dehradun for 2016. Dr. Prakash has published more than 150 peer-reviewed papers in national and international journals. I request all of you to join me in welcoming Dr. Prakash Chauhan. Unshared kar do.
Sir, unmute yourself first, sir. Unmute.
खुद करना पड़ेगा क्या आपको?
नहीं सर, वो खुद करेंगे हम अनम्यूट नहीं हो, वो अनम्यूट नहीं हो पा रहा ना सर. Sir, voice is not audible, sir. Sir, voice is not audible, sir.
Sir, kindly unmute yourself and speak. Problem है.
Sir, no, वहाँ पे वेबएक्स में किसी ने अनम्यूट नहीं किया लिंक पे.
हम यहाँ से कर सकते हैं?
नहीं सर, यहाँ से नहीं कर सकते. वो लॉग आउट हुआ, बाहर अभी लीव कर दिया, वापस ज्वाइन करेंगे.
Okay.
Can you hear now?
Yes sir.
Yes, sir.
Okay,
Yes, sir.
fine. तो ये share भी कर दो presentation.
Yes sir.
Can start share. Can you see our slides?
Yes sir.
Yeah. So thank you, Dr. Soni, and thank you all the colleagues joining from IMD Delhi. We also have Dr. Mrs. K. Nagaratna Madam, Director IMD Hyderabad, and other colleagues from IMD at Hyderabad, and my own colleagues here at the National Remote Sensing Center. First
I think we have to give a bouquet also.
Yes, please. Please welcome Dr. Prakash Chauhan.
Want to say something? Then you can say, then I will proceed. Okay. So thank you very much for India Meteorology Department, and especially in particular to DG IMD, Dr. Mrityunjay Mahapatra ji, for giving me this opportunity to speak with the entire India Meteorology fraternity as well as other colleagues on this occasion of 150-year celebration of India Meteorology Department. I would like to congratulate IMD under the leadership of Dr. Mahapatra, as well as all the staff members of IMD at Delhi and all 6 regional centers, on this occasion. Today, I am going to talk, mainly about how the space technology is being used for disaster risk reduction in the country. And this becomes more important in the context when we are talking of changing climate, not only in our own country, but throughout the world. Let me, of course, I have already talked about it, but let me put it, formally, the major achievements and, the kind of accolades India Meteorology Department has brought to the country in last 150 years. And space technology has also been a partner, and we have been working hand to hand in terms of, revealing various mysteries related to the weather. And of course, when it comes to the climatic observations, the space data is very valuable. And of course, IMD is a premier organization of the country, which deals not only with the weather, but they deals with the multitude of the subjects, including water, hydrology, seismology, and they provide services to various stakeholders, organization, as has been depicted from this picture, which I have taken from the Meteorology Department itself. So on this occasion, once again, I congratulate all the weather community of India, and we are very thankful for your services. And I am sure that with the help of space technology, we will be, able to. We have already achieved a lot of, precision in the weather forecasting, and I am sure that in days to come, we will also be gearing up for improved early warning systems when it comes to the disaster risk mitigation in our own country. Now, when it comes to space technology, all of us know that today India is one of the leading space powers in the world. We are in third or fourth, major space faring nation in the country, but it all started with a very humble past. And in particular, remote sensing and Earth observation, which is very critical to the meteorological observations, started with a pioneering experiment, which was also steered by one of the great meteorologists of the country, Professor P.R. Pisharvati, where he has basically studied the coconut wilt root disease by using the aerial photography in Kerala. And that's how the early remote sensing campaigns started. And it's also very, interesting to note that a meteorologist was behind this remote sensing experiments. Subsequently, we also started receiving satellite data from Landsat series of, satellites in 1972 onwards, which was an American system, and currently also provides, valuable Earth observation data sets. In Hyderabad in 1979, we established the first, Landsat Earth station, and today it has basically got transformed after 50 years of NRSC. In the month of September last year, we celebrated the Golden Jubilee celebrations of National Remote Sensing Agency erstwhile, and now it is called NRSC. So this facility is, I will be talking in detail about it subsequently. And of course, in 1979, and then subsequently in 1981, we had the launch of Bhaskara 1 and Bhaskara 2, satellites which were carrying optical and microwave sensors, essentially to give a broad general idea about the land surface processes and some of the, the atmospheric phenomena which were measured through the microwave radiometers. So this was the early days, but now today we have, a very sophisticated, the space program. But we should not forget the kind of, initial work which was done in terms of, the institutional framework for, for the use of space technology in various departments. So in that context, in 1977 itself, the first INSET, coordination committee was conceived, essentially to talk and to, discuss with the weather community the configuration of the Indian nationals, the satellites. Essentially, they were basically communication satellite systems, but they also carried meteorological payload. And of course, there was committees on space sciences, and then planning committee on natural resource management in 1995 got established. So, in those early days when the space activity was just initiated in the country, very important policy decisions were taken up, and which led to, the establishment of a National Remote Sensing Agency, and of course, identifying various societal benefit areas where the space could play a very important role. The satellite systems, especially the Earth observation satellite system, has evolved in a long way, starting from the first IRS-1A satellite series, which was, conceived and launched in 1988, where we had, this optical imaging capability, what we call is the 3-tier imaging capability. And then, of course, we also launched, 3-dimensional mapping satellites like stereo satellites of Cartosat 1. Then, of course, the radar imaging satellites to overcome the, the Earth imaging during the monsoon period. And of course, to help our meteorological community, the scatterometer payloads were also conceived, which are also kind of, microwave radar systems, which provides wind vector information over oceans. And then, of course, we also had with the French, the altimeter, a Ka-band altimeter to give a lot of information on the ocean, the sea surface heights in our oceans. And of course, now we have moved towards very high resolution imaging systems as far as the remote sensing for resource mapping, and of course, giving a lot of valuable data for disaster risk reduction is concerned. But at the same time, it is also important to talk about the INSET series of satellites. So the first INSET-1 series was conceived, and the satellite INSET-1A was launched in 1983, which has two-band imaging capability at 8-kilometer spatial resolution, 4 images per day. Many of us, those who have lived in the Doordarshan era, you all may recall that how, at the end of each of the news telecast from Doordarshan, how those INSET images telling about the weather patterns of India, they're all, the nostalgic, era of early days of INSET imaging, and the linkage between the meteorology was, done. Then, of course, in 90s, we advanced to INSET-2 series, where the 3-band imaging in 4 images per day were captured. But the real transformation as far as the meteorological data coming from the space platform took place when we had, in 2013, the INSET-3 series of satellites, the INSET-3D as well as INSET-3DR. And then last year, we had the launch of INSET-3DS, where we have two specific, sensors. One is the the imager, which is a 6-band imager, which provides 1 kilometer spatial resolution images in 6 different, channels in visible, infrared, and SWIR, and of course in the thermal imaging, bands. And then of course 19-channel sounder, which basically gives you a capability to provide temperature and humidity profile in the atmosphere. So by combining, of course these satellites were providing 48 images per day. But by combining 2 satellites, this frequency basically resulted in every 15 minutes weather patterns, and the associated geophysical parameters which were derived in satellites became, the great workhorse for entire meteorological community in India for precise forecasting of weather and the related phenomena in the country. Now, having said all that, today, as if we talk about the India's space program, in totality, we have complete, indigenously developed, the launch capability in terms of our rockets like PSLV, GSLV, and of course, we have recently developed a small satellite launch vehicle also, essentially to cater to the small satellite, business in terms of launching, the micro satellites and small satellites. Of course, we have also launched large amount of, spacecraft. Today, we have capability of indigenously developing various sensors, both in microwave, optical, as well as in the thermal part of infrared, spectrum. And then, building these or putting these sensors onto the satellite platform, and then essentially developing the entire ground segment to receive the data from spacecraft, process this, generate valuable information, and disseminate to the users. At the same time, ISRO is also involved in large amount of space exploration activities, with the launch of Chandrayaan-1, Chandrayaan-2, and very famous Chandrayaan-3, and of course the mission to Mars, and then of course some of the recent missions, especially to understand the space weather from our Aditya L1. Yesterday itself, we have now released the data to the entire heliophysics and the solar community from our Aditya L1, which basically completed 1 year. So in a way, many such activities are currently being done in totality in terms of, the launch services, building satellites, launching satellites for the foreign countries, doing certain experimental work. But basically, all these activities are people-centric and they are application-driven. And the major flip to the space activities in India has also come from the space policy of 2023, where the private sector participation has also been opened up. And this today, the space activities are not only limited to ISRO, but a large ecosystem which is supported by the non-governmental agencies is also built. In the last 3-4 years, more than 100+ startup companies are now operating in the country in various domains of space technology. What essentially it means that we are now moved where the space has become ubiquity. That means the space information or the space-based information is part and parcel of our daily life. Many of us may not be aware, but we are using space technology. if we are talking to each other sitting, in different cities, somehow either through internet or through space-based communication systems, we are connected, 24/7. We are also using large amount of positioning, navigation, and timing, PNT services from various GNSS constellations. If you have to move in Delhi from airport to some of your locations or unknown location, all of you are using today some kind of navigators. So most of them, they are working on GPS systems. Some of them are now also shifting to India's our own, GNSS system, which is called Navig. And then there are other global, GNSS systems like Baidu and other things from different countries. So the PNT services, position, navigation, and timing, synchronizing the timing across various timing zones in the country, as well as with respect to other international countries, is also very important. And PNT services has become the backbone of today's, modern infrastructure and economy. Similarly, the Earth observation, where we will be focusing more in today's talk, is also very important in terms of mapping, monitoring, impact assessment of activities like climate change, building livelihoods in terms of providing critical services for sectors like agriculture and water, and of course, assessing the climate impact and then building a climate resilient societies. So these three sisters in space, as we call it, Earth observation, satellite communication, and satellite navigations, are essentially has become, very integral part of our daily life. And they are all basically directed towards achieving the sustainable development goals, which basically all of us has committed under the United Nations platform, and which most of the countries are supposed to achieve these SDGs by 2030. And there is a reporting mechanism where also large amount of space data is being used for impact assessment of various initiatives. Now, when it comes to the disaster, and specifically the disaster profile of our own country, we are frequented throughout the year with various kind of natural hazards, which include floods, cyclones, earthquake, landslides, droughts. We also have, of course, increased intensity of this glacial lake outburst flooding, or popularly known as GLOFs, and of course the forest fires because of the extreme heat, which is increasing every year. So entire our coast, which is more than 7,500 kilometers, is prone to cyclones. Then 12% of our land is prone to floods. 25% of our area is also prone to seismic activities, in particular the entire Himalayan belt. Morning itself, we had a massive earthquake in Tibetan region of around 7.1 magnitude. IMD through NCS is also a responsible agency for providing seismic data to the country. And of course, we have 36% of forest cover. Of course, 23% of the forest cover is today standing on, as far as the Indian geographical area is concerned. But many of the areas just in the vicinity of this forest is also likely prone to the forest fires. And of course, the northern territories in Himalaya and then Eastern Ghats and Western Ghats, we also have occurrences of landslides. So in a way, nowadays, throughout the year, you will have, news of various kind of disasters which are happening. And we have to adopt, practices in terms of mitigating these disasters, monitoring them, and also, in terms of damage assessment, large amount of information needs to be generated at various scales. And of course, as we are, witnessing every year, the magnitude of these disasters are also increasing, and the economic losses which are associated with disasters are also on rise. So in one study which has been recently published, India is considered to be the fourth country in Asia Pacific where large amount of economic losses, especially due to the weather disasters, only due to the hydrometeorological disasters, are occurring. So in that context, it is very important to understand this entire cycle of disaster management and how best we can mitigate it. On top of this, all of you are aware, you are all into weather and climate community, that we are also facing, the challenges which are occurring or which are basically due to the changing climates, mostly due to the anthropogenic activities, and hydroclimatic extreme events are also on the rise. Some of you have already published a lot of good work on, especially in terms of quantifying these hydroclimatic extreme events, but most of them are triggered because of the enhanced carbon dioxide emission because of the anthropogenic activities in the post-industrial era. So what I'm showing you a beautiful animation which has been built by by using satellite data from the orbiting carbon observatory, where you can see how the northern hemisphere has high concentration of CO2 compared to the southern hemisphere, simply because of the large continental area, and most of the northern hemisphere is highly populated, and the kind of industrial activity and in terms of emission, you can see a dichotomy or a kind of a imbalance as far as the CO2 concentration in atmosphere is concerned. This also tells you that the atmospheric circulation has no regional boundaries. So any emission which is happening in Europe or America, it reaches to countries like Africa where their emissions may not be that high. So this is known as the climate injustice. Somebody is doing something, but all of us are suffering because of those deeds. So this particular animation is a beautiful depiction of that phenomena. Now, since the higher concentration in CO2 in atmosphere is leading to that temperature rise, we are all working hard to contain this temperature rise well within 1.5 degrees Celsius. But there are international treaties and declarations, but nonetheless, we have already reached 1.3 degrees Celsius, and now people are revising those estimates, and India has also signed certain pacts, the Paris declaration, where we have declared that by 2070 or so we aim to become a net zero emission countries. But in that context, as far as the extreme events are concerned, a lot of studies have been done that they are on rise. But what is more worrying is what we call as the cascading effects of this extreme events. One event leads to the another event, and I will give certain examples of that. And extreme rainfall events leading to deforestation, leading to landslide activities, leading to large amount of water storage at one location, extended flooding, and then the previous talk was talking about the health impact. So many such cascading disasters happens because of one particular extreme event. So we need to worry about some of these cascading disasters also in the newer reality of climate change. What essentially is required, we cannot stop many of these natural hazards to happen, but what can be done if we can map the hazards, if we know the exposure, and if we can map the vulnerability, we can basically map the disaster risk for the communities and then try to mitigate the adverse effect of these disasters. So essentially, I will be giving certain examples where all these technological tools which are there at our disposal, how are being used in our country to reduce the disaster risk in various phases of occurrences of disasters. Now, if we talk of some of the recent extreme weather events which has happened very recently in the last year itself, IMD has reported in 2023-24 that 126 extreme heavy rainfall events has occurred, where more than 200 mm rain has happened during the 2024 monsoon itself. And the highest frequency in last 5 years was reported last year. And several of these events have led to significant losses, both in terms of the human life as well as in terms of the the infrastructure. So classical example is the Wayanad landslide, which occurred on July 23rd, 24, which basically got triggered with the multiple episodes of rainfall, and it has affected more large number of people. I think more than 400 people were reported death, and then large amount of catastrophic disaster has happened over a period, over an area of around 8 kilometers or so. Similarly, a very unique event happened last year in Telangana, in a district called Mulugu, and I will talk about it, where large area, the forest loss has happened. More than 1 lakh trees got uprooted because of an weather pattern, which, and it has led to huge losses of forest ecosystem, and we call it the ecological disaster. The extreme weather event are also causing this type of ecological losses of large extent. In Andhra, especially in Vijayawada and in Bihar, extreme flooding events was caused by many of these extreme weather events. Cyclone Dana also, was a very powerful cyclone which occurred last year. And of course, we had in 2023 this Glof event of Sikkim, which also basically resulted in large amount of loss to the human lives, and a very unique and peculiar event. Before that, in 2022 also, you had 2021-22, you had this Chamoli, event, which was also a very unique, unprecedented event where large amount of casualties as well as damage to the infrastructure in Uttarakhand has happened. So when it comes to use of space technology, today we have various observation platforms, including satellites, aircrafts, drone systems, and of course IMD has a very dense network of ground-based observation systems. So using all kind of tools at our disposal, today we are in a very good state where we are able to work throughout various cycles of disaster, either in preparedness phase, early warning phase, and then providing during the cyclone the near real-time services. And once any kind of damage has happened due to any natural disaster, we also have an ability to very quickly estimate what we call as the post-disaster need assessment in terms of financing the disaster risk recovery. So the classical example of early warning and very successful example is the cyclone early warning system, and I must compliment IMD and Dr. Mahapatra, who himself is known as the cyclone man of India, that today our cyclone early warning system is so precise that within 3 to 4 days we are able to give realistic information about the occurrence of the cyclone, and of course within 20 kilometers of precision the landfall points and very accurate estimate of the wind velocities during the cyclone. All this has been possible due to the observational network at different scales, ground, aircrafts, as well as satellites, which has achieved this kind of feat and which is saving large amount of life in the country. Similarly, many such attempts are being done in the country, and NRSC is also doing a lot of work in terms of flood early warnings. We are using IMD forecast, and we are doing two-dimensional flood forecasting in Tapi and in Godavari river basins. And of course, various other, I will be telling in detail about each of these activities. So in ISRO, we have put up an infrastructure, what we call as the Disaster Management Support DSS system, which basically provides support to various early forecasting agencies, including IMD, Central Water Commission, Geological Survey of India for landslides, and all this data which we are collecting with the help of our satellite systems or by invoking international charter activities essentially goes through a unified geospatial platform to various stakeholders like Ministry of Home Affairs, National Disaster Management Agency, State Disaster Management Agencies, including transboundaries issues through Ministry of External Affairs, forest-related information to FSI, landslide-related information to Geological Survey of India. When it comes to forest, we have set up a almost 24/7 near real-time forest fire detection system with the help of space technology, which is very effective in terms of mitigating the various adverse effects of forest fires across the country. Now, when we talk of today's available assets in space, of course we cannot compare with many other countries, but we do have a good amount of assets in space. But however, we need to replenish and also add many more satellites if we can do effective disaster response. But currently today we are operating all our satellites in 4 thematic series. One is the natural resource inventory and disaster management series of satellites. We are operating 2 satellites, Resource-Set 2, Resource-Set 2A. Essentially, they provide imaging capability of around 6 meters, 23 meters, and 56 meters with different revisit capabilities. But to overcome the adverse effect of cloudiness in terms of seeing the surface, we also have currently a C-band synthetic aperture radar mission called RISAT-1A, which essentially is very useful for mapping the floods, and we'll see some examples subsequently. Of course, in terms of assessing the damage caused by any disasters, you need high resolution imaging capabilities. So we are currently having Cartosat 2 and Cartosat 3 series of satellites, which basically provides you around 0.5 meter spatial resolution imagery in what we call as the pan sharpened on the data fusion related products. Of course, oceans are also very critical for us. 70% of our the geographical area of our planet is covered by oceans, and India, both Arabian Sea and Bay of Bengal Indian Ocean, is very critical when it comes to the ocean atmospheric interactions. So currently we are operating a OceanSat-3 satellite, which is also funded by Ministry of Earth Sciences, and we are building another new satellite called OceanSat-3A, which will be launched either this year end or maybe early next year. So we'll have the capability of 2 OceanSat-3 satellites, which have very important sensors like scatterometer, which gives you around 12.5 kilometer wind vector over oceans. And then, of course, the ocean color monitor, which is also very useful in terms of understanding the reflectivity of the sea, knowing the albedo of the sea, as well as understanding the primary productivity of the oceans, which are also used for a lot of other activities like fisheries and in terms of understanding the carbon sequestration into the oceans. In OceanSat-3A, 2 more sensors will be added. One is the sea surface temperature monitor, as well as we are also going to add 1 more sensor called microwave humidity sounder, which will be very important for the atmospheric community in terms of knowing the humidity as well as the temperature profile in microwave domain, so that in case of insect, you have certain limitations during the cloudiness, but when you go to the microwave domain, you will be able to get the continuous information about the humidity and temperature profile in the atmosphere, which is very important in tropical areas for the weather forecast purposes. Of course, these are some of the examples which I am showing you here. What you can see, our the Parliament House, the old Parliament and the new Parliament House. This tells you about our high resolution imaging capability, and using our OceanSat-3 data, we have the capability to map phytoplankton dynamics in entire ocean regions. And of course, the scatterometer gives you beautiful, depiction of this cyclogenesis or early part of the cyclone formation in terms of giving very precise estimates of the wind vectors. Not only 2-dimensional information, we also get, from space, the 3rd dimension. That means the topographic information. So we had this CARTO-1 series of satellite called CARTO-1, which was launched in 2005. And using large amount of data from this CARTO-1 series of satellite, we have now come out with a pan-India CARTO-DEM at 10 meter by 10 meter grid interval. And of course, recently we have also processed this data to provide digital elevation information at around 2.5 meter grid interval. So apart from that, if you need any high resolution DEM services, we also have aircraft as well as the drone capabilities to provide you even sub-meter level of contour information. This is just one example that how this DEM helps, especially wherever you have terrains in terms of knowing the terrain as well as navigating through this terrain. So this is a fly through sitting wherever you are. We are just going to fly over Gangotri Glacier from where the mighty river Ganga originates. So now we are just near Gomukh, and now we are just going over the Gangotri Glacier. So you can see the kind of details, the morphological details these glaciers have, which basically enables us in terms of understanding the various glacial processes as well as the slope and topography of these regions. So not only these are all beautiful fly-throughs, but this data is very important in terms of understanding the slope and terrain in some of the Himalayan regions or some of the terrain affected regions of the country. Of course, satellites are also very wonderful tools. When we create what we call as the essential climate variables, that means we are analyzing these data sets over a period of time, which essentially runs into decades, predominantly 2 to 3 decades of satellite data have now been, stitched together by, taking care of radiometric and geometric issues related to satellite data, and very stable products for understanding the impact of the climate change, agents of the climate change, and then of course modeling and the impact assessment for future has already been done. We have in NRC a service called the National Information System for Climate and Environmental Studies. So under this NICES program, large amount of ECVs are getting generated, which essentially are very important in terms of understanding the various aspects of climate change, including monitoring of greenhouse gases, biomass burning, assessment of terrestrial carbon storage, and then of course understanding the impact of some of these variabilities on sensitive ecosystems like glaciers, polar ice caps, alpine zone forest mapping, impact of the warm temperature in sea on coral reef, and land degradation processes. So satellites not only play an important role in understanding weather, but it also plays very important role in understanding the climatic variability and their impact. What I would like to talk, and many of you are aware, especially in the IMD community and the meteorology community, about our meteorological satellites. That's the INSAT 3D series of satellites. But recently, last year, we have launched an improved version of INSAT 3D and 3DR, which has certain issues, but now all those issues have been sorted out. And today, now 3DR and 3DS are providing, almost 30 geophysical products at every 15-minute interval in a very precise and unprecedented manner. And we also have this rapid scan services, where essentially one of the satellites will be focused more onto like upcoming or ongoing cyclones, and then you will get rapid imagery of that particular area. So this is an image of the Fengal cyclone, which has happened in the last month itself. And this data is going to IMD directly. Many of you are using. Another important data set, which is also very critical to weather forecasters, and especially in terms of early warning of cyclone, is this scatterometer data. Scatterometers are basically radar systems, which basically provides you multi-view in a conical scanned fashion, and then using certain algorithms, what we call as the geophysical model functions, we are able to resolve not only the wind speed, but we are also able to provide you the wind direction with very precise details. And there is a process called cyclogenesis. So once the winds start curling, this cyclone, this scatterometers has this capability to pick up those areas where initiation of cyclone happens. And this information directly goes from NRSC today to NCMR, WF, and to IMD within less than 180 minutes, and it gets assimilated into the numerical weather forecast models. So an entire apparatus of not only satellites, but the ground segment chain receiving this data, processing this data, and disseminating it to the end user has been established at National Remote Sensing Center here in Hyderabad. Apart from that, during disasters, we have these our own assets, but many times we find that all these satellites becomes also inadequate in terms of providing coverage and timely data for disaster situations. So we have an international charter for space and major disasters. Essentially, it is a voluntary coordination group of various international agencies, all major spacefaring agencies, where we have agreed to come together and share assets. So one particular country, member country, can invoke charter, and then all the stakeholders and all associated agencies start providing satellite imagery over the affected region. And it's very important and a very good initiative of international community. And we have seen that we get large amount of data, especially when the disaster is happening and post-disaster, in terms of assessing the impact of such disasters. Flood is a recurrent phenomena, and in India, as I told you, more than 13% of our geographical area every year gets inundated, and newer areas sometimes we are seeing are now also getting floods because of these extreme weather events. In NRSC here, we have put up a service. Basically, we do mapping of these floods in almost near real-time domain using any opportunity data sets, either an optical as well as the microwave data, which is available at its disposal. And within a turnaround time of 3 to 4 hours, these flood maps are basically disseminated to the state agencies as well as NDMA, so that the decision making on the ground can happen. And these are some of the kind of flood maps which you are able to see, where not only we give the maps, but we also give associated attribute data in terms of road, or in terms of the population, or in terms of all possible GIS layers which are available through our NDM portal. Another pan-India map which you see, essentially we also do at the end of the season the cumulative flood mapping. So you can see all these red areas over India's map in 2023 are essentially the areas which just flood affected in that particular year. This is another example where a synthetic aperture radar which can see through clouds, because most of the time there are clouds during the monsoon period. The SAR has this wonderful capability. So all these black areas are nothing but the flood inundation areas, and along with the other, the geospatial layers, this information is also disseminated in near real time. As far as the flood early warning is concerned, the nodal agency is the Central Water Commission. They also provide flood early warning, but we are now developing and almost mastered the two-dimensional flood forecasting, which is known as the special flood warning. Essentially, we use the IMD's forecast for next 48 hours, and then using this forecast data, the routing of the water, which is likely to fall onto the Earth's surface, where you need very high resolution digital elevation information also for Tapi and Godavari. Now this system is operational, and from this year onwards, now Central Water Commission is going to take it up for operationalization, and we are now going to extend this particular special two-dimensional flood early warning system to other major river basins of the country also. Apart from providing response during the flood, as well as the flood early warning, NRSC has also developed what we call as the information data bank for preparedness phase. Essentially, what it means that we have generated what we call as the flood hazard zonation atlases for the entire country, where last 25 to 30 years of flood layers, which has been mapped every year, have been put on a cumulative basis, and 30 meter by 30 meter grid, a cumulative flood occurrence frequency has been plotted. And what you see here, especially in case of Bihar state, you can see in detail, the flood hazards have been mapped into 6 categories. And this data is very valuable for planning purposes, as well as in knowing the areas which are most vulnerable for repeated floods. There is large amount of demand for such data by the insurance players, where people are trying to develop parametric solutions for disaster management, because the disaster risk transfer by third party is a very important aspect of the disaster risk reduction. And in such cases, large amount of scientific database in our country are missing. And this type of databases, which has been generated with the help of space imageries, are getting a lot of traction, and people are really getting involved, and they are trying to get this data from us so that they can generate some kind of parametric insurance products for at least providing insurance coverage for flood affected areas. Another example is this district-wise inventory and ranking of landslides. So using the satellite imageries for the all landslide prone districts in the country, we have come out with what we call the landslide exposure, the atlas of the country. And as you can see, the district-wise ranking has been generated, and the most landslide affected districts, there are total 146 districts, but Rudraprayag, Tihri, Rajouri, Thrissur, Palakkad, Malappuram, and Kozhikode districts of Kerala, they are the most highly ranked districts in terms of the the exposure and in terms of frequency of floods, frequency of landslides are concerned. Many of you may recall this, the Wayanad landslide event last year in the month of July in Kerala at Wayanad district in a place called Churumala. This was a very devastating landslide. It happened night time around between 1 a.m. to 2 a.m. on that day. And in the morning itself, when news broke, we started getting lot of requests for providing the most updated satellite imagery of this disaster, because the scale of the disaster was so large that it was difficult to understand that what really has happened. So we have invoked all our resources which are available with us, especially we had cloud cover during this area. So we were fortunate to get radar image, very high resolution, 50 centimeter radar image from one of our our assets in space. And we could map the crown of this particular landslide, which basically was also associated with a previous landslide which has occurred in 2019-20 time frame. And the entire path of the landslide could be mapped very rapidly with our team here at National Remote Sensing Center. So what you are seeing is around 8-kilometer area got affected, and many houses, which has been plotted with red color, around more than 200 buildings got affected during this process. And this was the first of this kind of information which came from the satellite images and the subsequent analysis which was released by National Remote Sensing Center. And I could also brief our Honorable Prime Minister just before he was to go to Wayanad for ground assessment about this entire episode, how it has unfolded, and the kind of damages which has happened, and the kind of the extent of damage which was there in at this particular location in Wayanad district. Later on, the optical data also, came about this area when cloudiness reduced, and you can see, of course, the extent is so large and the resolution details. I have just reoriented the entire map, so you are seeing as a horizontal, strip, but essentially north is, towards where I have written August 12th. So you can see that the entire region where this previous landslide and the riverlet was there, how much, the water has flown that particular night in this area, and then around this old riverlet or river course, large area got damaged, and this total extent was of the order of around 8 kilometers or so. Now, some of these phenomena, if we have to investigate, we have to also see that what are those meteorological phenomena which are causing this type of, extreme rainfall events. Many times we are not able to look beyond, our visibility zones, but satellites provides you this unprecedented, visibility as a planetary scale phenomena. So very interesting planetary scale phenomena. Many of you must have heard people talk what concept called atmospheric rivers. And of late, it has been reported that these atmospheric rivers are becoming more stronger. They are bringing large amount of water vapor from tropical areas to the northern territories. And you can see that some of this, transport of water vapor from which originates over ocean, how this gets transported towards the land areas. And when such kind of, lineated phenomena, they strike land, massive amount of, rainfall occurs. So there are systematic studies which has been done, recent studies by groups in IIT, Gandhinagar, and some other researchers in India have also found that 80% of recent flood events in India are associated with some kind of atmospheric river phenomena. Some of my colleagues are working extensively here in NRSC on this, and we have tried to, link some of this recent, extreme weather events with this massive transport of water vapor from which are originating from the sea, and essentially the seas are becoming warmer because of the climate. So this is an event where essentially the water vapor conveyor belt of 20th July, or in July month was mapped, and you can see the large transport of water vapor from our INSET data in red color was happening in this region, in the month of August because of the monsoon activities. But what really has happened on the July 30th is also very significant, that this particular event has struck, and you can see the IMD data and then interpolated rainfall pattern on 30th July, and of course on 31st July, and the rainfall events, the chronology of various, high intensity, more than 200 mm rainfall events have been plotted. Now this concept of, antecedence rainfall, that means multiple heavy rainfall events essentially saturates the soil of this region, and one more event essentially leads to the, the landslide events. So such type of phenomena, what I was talking called cascading effects, are becoming very, very important. The second event is this Vijayawada flood event, which is also, seems to be associated with large scale water vapor transport from Bay of Bengal towards Vijayawada, is also very well captured using INSET, the water vapor imageries, which has also, triggered, a cumulative rainfall of around 327 millimeter against a normal of 14 millimeter or so, which has basically led to huge amount of inundation and flooding in this region. The third very important aspect which we found is also linked with similar kind of situation is this forestry mortality, essentially due to extreme convective weather events, which has been mapped using INSET data here in these view graphs. You can see what really transpired on that day, that convective, extreme convective and very cold cloud systems has hit this particular region. And we found that, we are now working out in bringing out the wind velocities also in this region. But essentially this linear patterns, which you see in brown color, was the area where large amount of trees, around 1 lakh trees got uprooted because of this very intense convective, cloud system which operated on that particular day in Telangana region. So this work has already been completed. We are now about to publish this work. But what I'm trying to say is that this type of, mesoscale weather patterns are causing very, unprecedented kind of, catastrophic cascading disasters, and this kind of ecological disaster were never heard of. More than 1 lakh trees, got uprooted in this whole area, and which basically our colleagues have estimated that around 4.4 gigatons of above ground mass, above ground carbon storage, which was there in these trees, has got, totally eliminated, which is basically around 16.3 gigatons of potential CO2 storage. So this type of events are really unprecedented and unheard of, which has also basically led a link to the climatic extremes. Another very interesting area is this GLOF, as recent WMO report suggests that the glacial ice loss is increasing every year, which you can see in the red color, and Himalayas, large amount of glaciers are losing, their mass. And this one particular lake, which is expanding rapidly, called Gepang Ghat Lake in Himachal. And using this, satellite data of different years, we have now mapped here at National Remote Sensing Center the inventory of entire glacial lakes in 3 river basins, that is Ganga, Brahmaputra, and Indus River Basin. And, this data is now available in form of atlases and digital databases also. And what we have found is that, in Indus River Basin, as well as Ganga Basin and Brahmaputra Basin, the lakes which have expanded twice or thrice, they have been plotted and mapped in this particular view graph. So long-term changes in glacial areas has been analyzed, and out of 2,431 glacial lakes, 776 glacial lakes are showing significant increasing trends. And they are all there, not in our geographical area. Some of them are in Nepal, some of them are in Bhutan, some of them are in Tibet region also. But in recent meetings of NDMA, around 190 such glacial lakes in 9 Himalayan states of India has been identified, which are now considered to be vulnerable to the GLOF. And these are the events which has happened on, in the 4th of October in Sikkim, in South Lonak region, where this particular glacial lake got bursted, and we could get entire satellite image sequence of this particular lake and could estimate that how much area because of this debris fall or the snow debris fall from the glacier has led to this catastrophe. But entire reconstruction of event and the amount of water which got released has already been done by our colleagues. But what is important in terms of doing this post-mortem, it is also important to understand the vulnerabilities of such glacial lakes. And of course, this particular event has caused significant damage. A mini hydropower plant basically got totally washed off in Sikkim. And then, of course, some people down the line, there were a lot of army camps and all. They also lost large amount of, the human casualties, and people also got affected by such events. But what is important is that these glacial lakes, we have to identify, some of them has already been identified, is to map the risk to the population which is living in the downward area. So one such exercise has been completed here at NRSC, especially for this Gepang Ghat Lake, where high resolution satellite data has been used to map the risk of this Sisu town, where large amount of army installations are also there. So similar such exercise required to be done. And then we also have to work out early warning systems and mitigation system, that how we can release, a systematic release of water from such glacial lakes can happen. This is the kind of risk mapping which we are doing for many of these glacial lakes which are vulnerable for GLOF activities. Now, having said that, it is also important not only to collect data, analyze data, generate information, but also disseminate this information to stakeholders. So here at NRSC, with the help of Ministry of External Affairs and with the help of all, early warning or forecast agency, we are now, come out with a geospatial portal called National Database for Emergency Management, or NDEM. The most recent version of this NDEM 5.0 was released last year by our Honorable Minister of State for Space, Science and Technology, Dr. Jitendra Singh Ji, where data from various agencies is basically getting populated today. It provides you multi-spatial geospatial databases. It also has decision support system tools, incidents reporting mechanism, post-disaster need assessment, resource management, and of course, the India Disaster Resource Network data, along with various mobile apps. All this information is available at one stop, and it is now being basically ported also at MHA's Integrated Center for ICRER, which is what we call Integrated Control Room for Emergency Response. This work is in progress and likely to get completed probably by next month or so. So this is the kind of activities which we are doing with the help of space technology as well as using geospatial technologies. It is it's good to talk about our achievements, but it is also required that we have to plan for the future. And in terms of planning satellite-based activities, Department of Space, along with the user agencies, is developing and talking continuously. And now we have got approvals for the next series of satellites, which is basically ResourceSat 3 and 3A for our resource mapping and high resolution, medium resolution disaster risk reduction analysis using these satellite data is also very important. Similarly, there is a need to update our topographic information, which essentially was captured by Cartosat 1A, Cartosat 1, essentially, which was there in 2005 and 2015 time frame or so. So now the two new satellites have also been approved by Government of India, called ResourceSat Sampler 3S and 3SA, which essentially will give you very high resolution topographic services. We are also going to have 3 new satellites for high resolution imaging and one more synthetic aperture radar satellite called RISat 1V, which will be similar to the RISat 1A. So by combining these 2 satellites, our capability to view in microwave domain will increase to 8 days, which is currently 17 days today. And of course, we are also working with the, in international collaboration with NASA, and the NASA ISRO synthetic aperture radar mission, NISR mission, is also likely to get launched in this year, sometime in the month of April or May. And then, of course, the thermal component or the temperature mapping of Earth is also important, and we are working with French team, and a satellite is being configured called Trishna, where at 56 meters spatial resolution, you will be able to get the land surface temperature also. See, SST, etc., many of you are aware that we get from our INSAT series of satellite, but that is at a coarser resolution. But issues like, the urban heat islands, urban micrometeorology, etc., can be, very well dealt with the high resolution temperature data, which is going to come from Trishna mission. And of course, as far as the meteorology community is concerned, we are also working in terms of defining the next generation meteorological imagers, and the 4th generation of INSAT, series of satellites already, the contours of these satellites have been drawn. Essentially, we will get away with the classical, the sounder, 19 channel sounder, but here we will have an advanced imager where it will have 18 bands from 0.5 to 13 micron, spectral range, with spatial resolution of around 500 meter in visible and 2 kilometer in IR, and fast scanning for nowcasting, applications, imaging in full disk, India-centric disk, as well as, to understand this mesoscale processes, especially, the events like atmospheric rivers, etc. Probably, these features will also be added. We are also planning to have a lightning mapper. I did not talk much about the lightning efforts which are being done in India, in NRSC and IMD, but that's also a very important component as far as the meteorological disaster is concerned. And then, of course, a hyperspectral infrared sounder is also likely to be there on this INSAT 4th generation satellite. The bottom image, what I am showing you, that there are advanced geo-imagers which have been put by various agencies, but Indian Ocean region has this big gap. And then I am sure that this 4th generation of INSAT satellite, which is basically being built on the, the request of Ministry of Earth Science and the deliberations with the ISRO and IMD and MOES teams, has led to this configuration, will be very helpful in terms of providing 3D wind profile from these hyperspectral sounders, which is very critical for your accurate weather forecasting. So we are looking forward for this particular very advanced satellite, and I'm sure that this will be of great use in terms of, enhancing the weather services in our country. Now, before I close, I would like to summarize in context of disaster. We all know that the changes in the water cycle in the atmosphere in warming climate are essentially, triggering these extreme weather events. We need to monitor them. We need to understand them. We also need to understand the mesoscale processes, which are basically originating in tropics, and the mass transport is happening to the subtropics with the help of satellite imageries. but it is also important to come out with what we call as the multi-hazard early warning system, where we think of, all kind of hazards and then cascading hazards in an integrated manner, which today, of course, we are dealing separately because the nodal institutions are very different. When it comes to floods, it is CWC. When it comes to weather, it is IMD. And when it comes to, let's say, seismic hazards and landslide, there are some agencies. And we need to work, and break these silos and work in an integrated manner so that we can aim towards multi-hazard early warning system for the country, which essentially will help us in understanding different disasters, actionable geodata, link these physical processes to the spatial temporal disaster scenario built up, and then, of course, better preparedness and effective response, which basically will lead to reduction in the the human losses as well as losses to the property, which is also becoming significant in terms of achieving our objectives to become a developed country. At the same time, the capacity building of each of the stakeholders, because many of the people in different agencies are still requires capacity building and capacity development in terms of using these space-based data sets for various activities. So that is also very important, and we are all already doing this, but I'm sure that we have to do it on a much higher frequency and higher pitch in times to come. With these words, I would like to thank each one of you for sparing a valuable time. And once again, I would like to congratulate India Meteorology Department on this occasion of 150 years of their foundation. Thank you very much. Best of luck to each one of you.
Thank you. Thank you very much, sir. So now we are open for, we can take up few questions from audience. So the online audience can ask a question by raising hand or by putting their questions in chat box here. So one question from Dr. Ashish Mitra is there. So can you unmute, sir, and then ask, or we can take question from here also? Sir, his question is...
yeah, please, Ashish, go ahead.
Yes, Dr. Prakash, nice listening to you. Very good talk. And can you hear me?
Yeah, we can hear you. Dr. Mitra, please go ahead. Thank you.
Hello, am I audible?
Yeah, you are audible. We can hear
Yes,
you.
sir.
Yeah. So my question is this tree estimation due to very severe weather. It's a very interesting new area I'm seeing. And how do you validate those results? What is estimated from satellite? Do you
Yeah,
validate
so
with
what we
some
did,
ground truth?
yeah, we have taken a multi-sensor approach. Actually, this the forest Telangana Forest Department only requested us. This was such a mysterious event. They were not able to comprehend that what exactly has happened. So our colleagues from EXA, Dr. Ramana and the team, they started pulling all the meteorological data, and then they have seen this type of phenomena which has occurred from satellite-based observations, ground-based rainfall measurements, and then we also have a very good drone team here with NRSC. So we have done the comprehensive drone mapping of this whole area, and a very high resolution centimeter scale data is there with us. So with that individual tree, how many trees have also fallen, that using an AI model, we are doing it. So that work is in progress, but as I told you, we have all kind of measurements which are available at our disposal for understanding this very unique phenomena.
Oh, thank you. Thank you very much. And the next thing I was about to ask, but so there is a big plan for using AI ML in many applications.
Yeah.
Thank
you
you.
are
Thank
muted,
you.
sir. Now, can you repeat your question?
So you have planned to use AI ML. So is there a group
Yeah,
already
so-
working on AI ML?
Yeah. So yeah, machine learning based approaches, as you know, in terms of advanced data analytics, because every year with the advanced satellites, high volumes of data are coming. It is impossible to analyze all this data. So we have set up what we call the AI virtual laboratory in all spheres in NRSC and ISRO. So we are now today, I'm happy to tell you that we have estimated the entire agroforestry potential of India. Individual tree level counting we can do using machine learning. We have also done, case studies for counting the installed solar plant capacity using machine learning. And then some of our colleagues are now also using, machine learning for nowcasting as well as lightning related issues in a research and, R&D mode. So we are also working with IMD and other colleagues in their collaboration. So I'm sure that this will go in long way in terms of analyzing the data and producing faster results actually.
Thank you so much.
Thank you, Mitra sir.
So I have one question here. As far as this disaster risk reduction is concerned, the monitoring of glacial lakes in Tibetan Plateau is also very much essential. So are we monitoring these lakes in Tibetan Plateau also?
Yeah, I agree with you, sir. You must have seen the reports. Many of the Tibetan lakes, actually, they have expanded very rapidly. And, especially we are monitoring the Aksai Lake in Aksai area, which is of course in our geographical territory, but controlled by Chinese. And many other, water bodies in Tibet are being monitored. We have an activity which we do along with Ministry of External Affairs. I don't want to talk much about it, but there is a mechanism here in place where we are monitoring the water bodies in Tibetan region also. And we do keep a tab of these activities which are happening across border in trans-border regions. Yeah.
So if you have any more questions, please ask.
Good evening, sir. Myself, Preeti. Thank you very much, sir, for providing such a informative lecture. Sir, I have one question. Sir, you have mentioned one disaster response dashboards. So in that, sir, only Indian satellite data is using, or foreign satellites data from foreign satellite also has been utilizing in that dashboard?
So Preeti, what happens? You see, we are not concerned about Indian data or foreign data or anything. We are concerned with data. When it comes to disaster, so we will use whatever data is available with our disposal. So in case of, severity of disaster, as I told you, we also invoke international charter. So a lot of information comes from all kind of observations which are available, whether Indian, foreign, private sector, government agencies, everything, whatever can be done, we try to do it. Now at NRSC in a regular domain also, we receive Indian satellite data, as well as we also receive, data like Sentinel, then data from MODIS satellites, USGS, Landsat satellites, all kind of possible satellite data are basically received at our IMGOS ground station.
Okay. Thank you, sir.
Sir, I have one question. Actually, sir, I want to know about like this snowfall. Where
please tell your name, sir. Can you
my name is Amit. I'm from IMD.
Yeah.
Sir, where these manual stations are not available, so can we get this snowfall data for that part of India, like especially in northeast part of India, like, and whether this NRSC provide any data?
So under our National
snowfall?
Hydrology Program, so under National Hydrology Program, we are basically providing the snow cover maps actually. How much snowfall has happened, that is difficult to tell, but basically the two-dimensional snow cover maps are being generated and operationally being provided. We are also running what we call as the slow melt runoff models. So how much this snow melting is leading to the runoff into the river basins, that calculation is also operationally done. So this information is available at our Bhuvan NHP portal, National Hydrology portal. So some of you can get in touch with us if you need. We will be happy to provide you the link also. Okay.
Okay. Thank you, sir.
Online.
Okay, I think
Sir,
there are no questions.
Yes, so sir, I think there are no more questions. So we thank Director NRSC, Dr. Prakash Chauhan. Sir, DGM sir has joined, and we request our Director General of Meteorology to say a few words.
You can unshare that presentation.
Yeah.
Namaskar, good evening, Prakash Saab. I'm sorry I could not continue in the talk. But
good evening, sir. Good evening,
yeah,
sir.
good
Thank
evening.
you very much for providing this opportunity. In fact, we were remembering you, and I congratulated entire India Meteorology, fraternity, which is being led by you, sir, on this occasion of 150 years of celebrations of IMD. And we are all there with you, sir, in our, support role. And we also discussed about future, possibilities and future Earth-based, space-based systems which we need to build along with IMD for improving the weather forecast over India, sir. So
yeah. So thank you very much, Prakash Saab, for making it possible and with your gracious presence for this special lecture. I am sure the entire meteorological community and space community will be benefited. And I also congratulate you because the entire meteorological fraternity is celebrating this 150 years. And when we think about you as an individual scientist, well-known scientist in the globe, and also the ISRO as our friend, you can say organizational friend, we all celebrate it together. It is the success of the country in the past 150 years that IMD has moved ahead to provide various types of services, and space technology has played a dominant role in detection and monitoring and prediction of various types of severe weather events. So it is therefore the joint progress, and we are working together. We'll work together in the future. And I request you and entire team to be present on 14th and 15th in the function being organized in Delhi. Okay.
Thank you, sir. Thank you for your invitation. We are already planning to be there, sir. And we look forward for that very wonderful event, which you are, very beautifully you are crafting on 14th and 15th. And we are sure from our side, NRSC, as well as from Department of Space, and all possible support and help from space community, sir, to IMD activities in current as well as in future. Thank you very much for this opportunity.
So thank you very much once again on my behalf and on behalf of India Meteorological Department. We express our deep gratitude for sparing your valuable time and addressing the meteorological fraternity in this in this auspicious day commemorating 150 years. I also thank Dr. Nagaratna for coordinating with you and making this possible. Now I request Dr. Nagaratna to felicitate Dr. Prakash Chauhan, our beloved friend and director of the institute in ISRO, for his valuable guidance, inspirations, and special lecture today.
Thank you, sir. Okay.
Thank you, sir. And now I'll present the formal vote of thanks. On my own behalf and on behalf of India Meteorological Department, we thank today's speaker, Dr. Prakash Chauhan, Director, National Remote Sensing Center, for kindly sparing the time with us, despite of very busy schedule. And I especially thank Dr. Nagaratna and other MC Hyderabad colleagues, Dr. Anup, and all my colleagues who are instrumental in organizing this lecture series. Thanks to all the audience who are joining us for last 29. This was the 29th lecture of series, and all the audience are wonderful audience joining us regularly for these lectures. And our thanks to our Director General of Meteorology for guiding all through this 1 year series of events for celebrating 150 years of India Meteorological Department. So thank you all, and looking forward to join. We request all the audience to join us again for next lectures. Thank you very much.
So just a minute, Prakash sir, we have got. Sorry, just 1 minute. I just want to say that we have organized various programs in the past to commemorate 150 years, and in the coming days also there are certain programs. So I will request please plan accordingly. On 13th we have got one-day national workshop on 75 years of Journal Mosam. On 14th we have got VVIP presence, and we will have the main function in the forenoon. In the afternoon, we will have a panel discussion. That is, it will start with national and international stakeholders meeting. And the first one will be an international panel. WMO President will be there, and WMO Secretary General will be there. And there will be presence of the permanent representatives of the countries from South Asia, Southeast Asia, Middle East, and also Japan and other countries. And apart from the PRs, there will be presence of the embassies and high commissioners from Delhi. They will be participating in that. So then it will be followed by a national level panel discussion. This topic is same. The topic is early warning for all. On this particular topic, first panel will be discussing about the global perspective, and it will be followed by the national perspective in the second panel. And the 14th will end with that, and then on 15th we will have the all national level stakeholders. 7 areas we have identified. One is, say for example, disaster risk reduction. Then we have got the health, then power, then renewable energy and transport. Transport includes surface transport, aviation, and navigations. And then also you've got urban sector, tourism sector. So like that, all the relevant socioeconomic sectors, of course, hydrology will be there, and the role of science and technology, all these things are there. So I will request that please participate accordingly. I will be happy if from 13 to 15, 3 days, you and your team are available.
Yeah, we will be there around 40.
Yes. So please try whatever is possible.
Yes, sir, definitely. This, 14th is the main program, or 15th is the
14th is main program. 14th is
main program.
Yeah,
Okay,
actually 15th was the main program, but because of the maybe whatever it is, so 14th is going to be main program.
You are bringing PM Saab is coming, or?
No, that is planned. So far there is plan. I was not telling explicitly because we are told not to.
Yeah, I know, sir. We were discussing casually only.
Yes.
No problem. Okay, sir. All the best, sir. Wish you all the best.
Thank you.
We will be there, sir. Thank you, sir.
Thank you.